So we're at the New Wave of AI in Healthcare 2024 conference. This is Dr. Sara Berger from IBM, and I'm excited for this conversation. So Dr. Berger, could you tell us what neuroethics is and how it fits in with ongoing research in AI?
Yeah, so thank you for having me. So neuroethics, very briefly, is the study of the ethical, legal, and social implications of neuroscience, and encompassing that is also neurotechnology and neurodata. So a lot of what I do now is think about the ways in which my neuroscientific research is embedded with different kinds of like ethical questions, societal questions, and so on and so forth. How is it related to AI? Well, as we've discussed today, right, like AI is scaling up, generative AI is like the hot topic now. At the same time though, neuroscience, neurotechnologies, neurodata is also scaling up. And so what we're seeing is this like bi-directional, almost like crosstalk of the two technologies like influencing each other. So, you know, this has always been the case of AI being like inspired by neuroscience, but now neuroscience is really changing, right? We need more data to get grants. We need more data to do statistics. We have brain-computer interfaces that are connecting with state-of-the-art AI. We have GPT models that are also translating brain imaging data and such. So I'm really interested not just now in neuroethics, but also in like this intersection of like neuroethics, AI ethics, and like data ethics as these two fields like converge. So
very interesting. So what is something that you would like to highlight about this research that you have been doing?
Mm-hmm. So I think we talked a lot today about the importance of like data-driven AI and just the importance of data in general. And I think something that's really important for all of us to keep thinking about, specifically with neuroethics and neurodata, is how do you even define what that is? You know, a lot of people will say it's information coming from the nervous system, but where does the nervous system stop and end, right? Like, we are embodied people. Many people will focus on like neurotechnologies or neurodata that's coming from the brain, but a lot of these wearables that we talked about today in digital health, they're making use of like EMG signals coming from our muscles, right? Or heart rate variability, which at the end of the day is controlled by our sympathetic and parasympathetic nervous system. So as lawmakers are trying to kind of start creating protections around certain kinds of data, what I've been researching more recently is what are the boundaries of neurodata and how do we use how people think of those to better like create more like precision regulation, but also figure out like what are we okay with sharing like from a data perspective? What are we okay with like allowing to be sensitive data and what aren't we? So that's what I've been working on recently.
Very interesting. So is there, I guess thinking back to this research that you've been doing, has there been anything that really surprised you in the past year that you've been, really focusing
on? I would say two things. One is just the speed of all of this. I started using AI at the very end of grad school, so back in like 2015, 2016, and this was still kind of like, a lot of people weren't doing this. And now like everyone's doing it, and it's like really hard to keep up. So I think like that's one thing that maybe that sounds obvious, but it's just surprising to me how fast this field is going. And the other thing is, because it's going so fast and there's so much spotlight on AI, and rightly so, I'm always also surprised by how much people aren't aware of like the neuroscience side and like the neurotechnology side. Like there's like over 30 consumer devices on the market that are like actually analyzing neurodata that people can buy now that are using AI, and people aren't really talking about it. So I'm always like surprised that we're so focused on this one thing, but at the same time, this is like also very real and very important and, needs to also be paid attention to. So I'm always just kind of, surprised by that.
Yeah, and also, including multiple stakeholders involved in this type of research.
Yeah.
So what are some of the lessons learned or best practices that you can share about fostering effective, meaningful collaborations between AI and ML researchers and healthcare stakeholders?
Mm-hmm. So I'm trying to think of like good best practices. I think in general, like leaving enough time at the beginning of the study to just get to know each other, to ask like pointed questions about like, why did you get into this field? So you can start understanding people's like personal incentives beyond maybe like their healthcare settings or their companies or their their backgrounds, you know. I think that fostering kind of that like relationship is really important. And the same is true also for if you're like working with patients as well, like getting to know patients and participants beyond the condition that you're studying, you know. So what else is important to them? What do they like to do? Like treating everybody in your group more holistically, like beyond just like, I have this task to do. That sounds obvious, but I don't think we give enough credit to doing that in the work. Another thing too is the value, I would say, of dissensus. So so much time is spent on trying to create things through like agreement, right? But we all come from different places. We all have different opinions. How do we leave room by design in our study for openness, for different ways of doing things, for making time that people can like provide feedback and critique what happens, and so on and so forth. So I think like, again, intentionally designing your study so that it leaves room for those moments and it creates opportunities for those things is really important. And I guess the last thing would be, enabling, like thinking of as broadly as you can about who are your stakeholders, right? Like it's not necessarily just your personnel or your team, but like in previous studies I've done, you know, we have people that are patients, patient representatives, their families. We have physicians, we have device reps, we have device programmers, we have all sorts of AI practitioners because AI is a massive field. You know, we have different kinds of neuroscientists, computational, behavioral. So like expanding kind of like what we mean about like diverse stakeholders and like how diverse can you really get, I guess, is another thing that I've learned.
It sounds like it's first starting with making sure that we're all speaking the same language before we start collaborating on the set project.
To the extent possible, yeah. Right? Yeah.
That is a big challenge, but
it's a huge challenge.
One.
Yes.
So, one of the things is you're also aware is that when we're measuring a range of patient-reported outcomes, there's a lot of heterogeneity. Due to a variety of reasons. But one of the big advantages of using these digital and mobile technologies is that we can, access a wide range of demographics and patients and, scale, measure outcomes from larger samples and so forth. So it's this, advantages. So are there things that researchers can do to, leverage these tools and technologies or whatever else that are currently available to, I guess, combat this between individual heterogeneity in outcomes? For example, pain outcomes is one of them, something that you and I both have done research in to kind of improve or, account for that heterogeneity.
It kind of goes back to something else that I said, which is like, if you involve patients at the beginning, you have a broader range of stakeholders, that means that you can capture more heterogeneous data. So sometimes I think a lot of the problem with heterogeneity is that actually we're missing some, right? We do our best with our expertise to kind of narrow down like what we should be concentrating on, and then that ends up missing like key aspects. And so then in some cases it's like there's still heterogeneity, but we're missing key components of the study. In terms of like dealing with it, once you have it, I mean, I'm a fan of embracing it, whatever that means. That's what's so cool, I think, about some of this like multimodal AI that's happening. I mean, even 5 years ago when I started looking at multimodal data, we just didn't have the capacity to put these things together in the way that we can. And so that made the more heterogeneous, like how do you make them commensurate? You couldn't, right? You'd have to pare this down. You'd have to reduce in ways you didn't want to. But now it's like, oh, we can align this on different time. We can align this, we can fill in with like synthetic data and simulated data and all these other things that we just didn't have, 5-10 years ago. And so I think I know I'm not really answering your question, but like, I think we just have to embrace it and like also like leverage that, because that's kind of where the richness comes from like experience, right? Like for pain patients, it's always going to be heterogeneous, always. So yeah, I don't know if that.
Yeah, it definitely does. Yes,
ultimately it gets into the whole, being more inclusive, being more aware, and then being more inclusive in all steps of the data collection, processing, and inference steps of the research process. So yeah,
Yeah.
definitely. Well, thank you so much, Dr. Berger. This was
Yes.
great.
Thank you.